Hello, this is Chris Roberts with HIEs Systems, and I'll be your moderator today. If you should need any technical assistance during this webinar, just refer to the information that's in the questions section of your control panel, and my name and contact information are there for you. We do encourage you to participate in today's webinar by entering any questions or comments in the questions section, and you may enter your questions at any time during the webinar. And for quality purposes, this webinar will be recorded. After the webinar, you'll have the opportunity to fill out a short survey to tell us how we did, and this survey will appear when you leave the webinar. Then for your time, your name will be entered into a drawing to win a $100 Amazon.com gift card, and all those drawings are held at the end of each month. We really appreciate you joining us for today's presentation. You've connected to an HIE, now what? Our speaker today is Michelle Schneider. Michelle is a solutions engineer with HIEs Systems focusing on the interoperability needs of hospitals, networks, regions, and states. Michelle has participated in EMR implementations and conversions, HISP and HIE implementations, EMPI management, and interface management and testing. She is a registered nurse committed to the mission of educating the healthcare community about interoperability as a means to improve patient outcomes. And now I'll turn it over to Michelle to get us started.
Great. Thank you, Chris. And thank you, everyone, for joining today. I'm really excited to share with you this presentation on HIEs, and you've connected, so now what do I do, right? I think many of us have had those questions run through our heads, and so we're going to dive into that a little bit today. I was really interested to see the group that is joining today, just so that you get a feel for who's on the line. We have we run the gamut. We have IT folks, directors of IT, clinical analysts, pharmacy informaticists, CIOs. We have quality folks on the line. We have people who use Epic, and people use Cerner, and people use Meditech, Magic, client server, 6X. So we have all sorts of a cross-section of folks with us today. So it's kind of neat to see that, and hopefully you all will get something out of this that you didn't know before you came, and have some good ideas for how to move forward. The idea for this came about because in many of our conversations, we're working with folks who are just, they've joined the HIE because they were supposed to, and now they're not really sure what to do next, and where do we go from here, and what value can we really get out of this HIE participation. So we're going to start with an HIE overview, and then we're going to just kind of go through some of the what's in it for you, talk about the advantages, talk about some of the common pitfalls, and how you can make this relationship, this partnership with your HIE work for you. We'll have some questions and answers throughout, and then hopefully we can just make some good progress here and see what we've got going on with all of you as well in the questions sections of the presentation. So when we talk about an HIE and what it is,
Michelle,
we have, oh yes?
Could you unpause your screen? I think it might be paused.
Oh, let me see here. Oh, there we go.
Perfect.
I'm
Thank
sorry.
you so much. No, that's okay.
I'm so sorry. Yeah, sorry about that, everybody. You didn't miss much. I was mostly talking, and I did just have it on that agenda for a little bit, so I'm really sorry about that. And so when we get into the HIE and we're talking about what it is, it's certainly more than interfaces, and it's more than an interface engine, which a lot of people, especially probably years ago, really thought of it when it first came about as really just an interface engine. And then certainly it's more than interoperability as well. And when I was thinking about what it meant to me, I considered a dynamic, multifaceted, living, breathing organism that can, at any moment, with the proper care and feeding, provide decision support to a clinician, analytics to a regulatory agency, or feedback to a patient. And that's I mean, that's huge, right? That is an amazing value that can provide to everybody, providers, payers, patients, really anyone who needs information. So we know it can do that, and that's the intention. So now we need to figure out how to make that happen for us, right? So some people will say, why am I bothering? Why is it worth it to me? And HIEs, as we were just saying, have tons of potential value. They can eliminate redundancy. Going to one doctor and you get an x-ray, and then going to another one and that physician can't see the x-ray the previous one took, so you're getting a second one for the same patient for the same view. And so we can eliminate that redundancy, and in so doing reduce costs, increase patient safety by having all that information in the hands of the providers making the decisions. We can improve patient involvement, which is so important and is really missing still with all of this technology, making patients part of their care, partnering with them, and making them responsible for some of this as well. They are the one common thread. They're the common denominator throughout all of the points of care as the patient. So making them an important part of the team, and clinical decision support, of course, for our providers. So what model works best for me? So some of you are coming here because you're part of an HIE and you're not sure what to do. Some of you are deciding if you want to get into an HIE. Some of you may not be participating at this point. So when you think about what's working best for you, there are a couple of different ways that you can join an HIE, certainly at the state level. There are some states that have a statewide HIE. Some have tried and failed, some are successful, and so it's not a cookie cutter model that works for everybody. And regional, so just on a smaller scale, you might have a county in your state that has pulled together all of the hospitals, providers, entities, healthcare entities within that geographic area and pulled together that HIE. And it could be private. There are some pretty large healthcare entities that have many different EMRs, many different provider groups, a lot of competition even within those, but they have created their own private HIE. So there's certainly a risk though when people join. So we did a focus group at HIMSS this year. We had a great participation, and one of the CIOs who was surveyed provided this response and said, we were connected to our state HIE, but the only data we were getting back was our own, so we stopped. And that's the risk, right? We put it out there and people join and then they don't feel they're getting value. So we as members of an HIE don't want them to stop, because where's the real value in an HIE? It's an exchange of information. If we're the only ones putting in, it loses value for us personally. So it's up to all of us to keep those people in the group, right? That adds value for everybody. So the holy grail of an HIE exchange is having all of these participants, and not just hospitals, not just physician groups, ambulatory offices, but you've got, your radiology vendors, your patient portals, you've got your states with immunizations and syndromic surveillance. You've got lab vendors like LabCorp and Quest Lab. You've got everybody participating. And certainly your payers are a large member here too that are important to be included. So this is the holy grail. You've got everybody. You've got bidirectional flow of information to and from all of these, and you have an EMPI in place that is going to manage patient identity. So these are the most important components, and hopefully are in place with the HIE you're using if you're involved in one. So the advantages for the hospital are, the services that are available to you as a member, and CCD, CCDA exchange. Many are struggling with that. If we can get all the information in the HIE and show that we can query for that CCD, we can grab that and send it when we are queried, that can help us meet a lot of requirements and make our providers, our patients happier. Results routing. So you've got, your CC'd physicians and you're struggling to manage that in your own hospital's EMR, you don't have the bandwidth, the HIE can manage that results routing. And I say can manage because most of them have that ability. It might not be working with yours because it might be newer, they haven't done that, or they haven't gotten to that point. So that's part of your homework that you certainly want to do when you are choosing which HIE to join. Alerts and notifications for critical values, for admissions, for discharges, for any alert that you define. Having a patient portal, an image exchange available, patients, you want them to be signing in. You want them to be a part of this as well, be able to exchange information. Analytics and population health, of course, are one of the greatest values, using direct messaging, and of course, public health reporting. So these are all some of the great advantages to the hospital, where each hospital is trying to do that singly. If you can partner with an HIE who can assist you with that, then that's going to relieve the hospital of that burden. So I do have a poll question, and I mentioned CCD Exchange, and I'm wondering if you do use your HIE in order to pull down CCDs. So if you could respond to that poll with a yes, a no, maybe you don't know, maybe that's not your role, or perhaps you're not currently participating in an HIE. So Chris is going to keep his eyes on that, and if you could please respond, that would be great, just to get some good participation here and see what we've got. So thank you to those of you who are responding. I do appreciate that. It will really help to make our time here more interactive. Looks like we still have people pushing buttons here. Give you a few more seconds. All right. Chris, that's probably good. We can stop it there. Thank you to everybody who has participated. Looks like we had a good number, and let's see if what we have is 24% of people are getting CCDs from their HIE, 41% are not, 18% don't know, and 18% are not currently participating in HIE, and that's the number that did respond. So thank you to everybody who did. It looks like we had a good number who had who reached out and touched that button, so I appreciate that. So keeping that in mind, most people are not, and I would love to have the conversation of why aren't you? Is it because you don't know how? Is it because you just have decided not to? You're doing it fine with your EMR, or is it that it's not offered yet? Your HIE has not given you the instruction, the how-to. So that would probably be my next follow-up. And I'm going to have a Q&A time coming up where we can please, as questions come to mind, put those in that questions box on the GoToMeeting screen. So now I just want to talk a little bit about information sources. So when we've got our HIE going, we have our hospital, of course, and hopefully you have a couple of hospitals who are participating, and they're all going to be sending their information to the HIE, and that's great. So everybody's putting stuff in, right? We're all sending it because we're supposed to. And sometimes we don't always know, all right, I'm doing it. They said they want all these feeds, and you might be sending it as a CCD that they're parsing, or you might have a bunch of separate interfaces that are just being sent to HL7 or flat files, or however you're doing that. So you just keep sending, right? And you're hoping a lot of people are sending so you can get all that value out of the HIE. And beyond hospitals, hopefully you have pharmacy data, long-term care, lab data, physician offices, radiology systems, home care, and they're all going to send too. And then, woo, we're really going to get a lot of value here, right? That's where it all comes into play, and they all just start funneling into that health information exchange. but then we get to our risk again, right? So we want to make sure that the blue hospital is not only getting the blue hospital's info and the orange hospital is only getting the orange hospital info, because then there's no value, and that's when we start to lose participation. So we need to make sure that that risk is mitigated by working with the HIE and making sure that they are, providing education, working with participants, and making sure people feel that there's a value. So we had received some feedback from people who are participating in HIEs. I feel like I'm doing all the heavy lifting. I'm sending all these interfaces. I'm managing those. I've got to monitor those. And then I don't feel like everybody's doing that same amount of work. I don't know, but I don't know that I'm getting as much out. So, it's all in there. Now what do we do? How do we compare to the other members? They want to see those analytics. How are how do we measure up? So, and are other people looking at our data? Is it de-identified? What's going on? So really trying to get that information from your HIE, making sure that that you have that information and that you can get it. It's certainly there. That's the whole point of the health information exchange, and really understanding that more is better, and sometimes that's part of the struggle. So as you join an HIE, you want to make sure that the people in your geographic area, the people that serve the same communities as you or like communities as you, are also participating in the same HIE. So the more who join, the more powerful it becomes. And the early adopters are really the ones who are taking the greatest risk because they are the only ones putting in for a while. But hopefully you start to see that, and you need to be a champion of the HIE as well. It's up to you to spread the word and say, hey, we're joining this one. Let's get all of our data in there because we'll be able to better serve the same population. There's overlap. We know there's overlap. That's not a question. So you want to hitch your wagon to the right horse. And so to do that, you really want to understand your own network's shared vision as well. So what is the goal for our patients? What's the goal for our providers, our hospital, our network? And how do we see this serving our community? And once you know those answers, then you can do your homework about those HIEs, and most of them have the capability. Like I said earlier, it might not have been vetted and implemented, but in general, any HIE is going to be able to put governances in place around access and making sure everybody's comfortable with that. Patient identity. Is there an EMPI in place? Are they doing the best job, as good a job as you want them to, on matching patients? Their patient data is coming from everywhere. Onboarding, and if your HIE isn't, it doesn't mean you're like, oh, forget it. It means we need to talk about this. We need to put some processes in place. As a member, you want to advocate for that, advocate for your network, advocate for your patients, and really be a part of onboarding. Push the HIE. How are they onboarding? Are they getting new members? How can we help? Can we, are there people in our community who are not members that we can help to pull together? Really see how you can use the HIE to help you meet your meaningful use requirements. They should be able to assist with public health reporting, analytics, showing the number of patients who've signed on to the patient portal, for instance. That requirement, did we meet that? Did we meet that at the EP level and the EH level? So those are things that you can really obtain if you know to push back and do that. If it hasn't been advertised or you haven't been educated on that, ask the question. Those are some of the things that you should be able to expect in most cases. So I'd like to open it up for questions if anybody has any. I'm not sure if there are any out there at this time, but if you have any, please. Oh, go ahead, Chris.
Yeah, we do have one. Just a reminder to put your questions in the questions pane there in your control panel. This one is, my state has multiple HIEs. Do you recommend connecting to all of them or just the one closest to us?
That's a good question, and that's a tricky question too, because I would not recommend participating in multiple HIEs as a general practice. Some people are part of a smaller HIE in their network. So their network has an HIE, they have an engine, they all contribute, they get analytics from that, they do some of their reporting from that, their public health reporting, CCD exchange, things like that, but then they also participate at the state level. That makes sense. If you have some really large ones in your area, we did have one hospital we worked with that was participating in one, and then they were going to stop and join a different one just because geographically their patient population had more activity in the other HIE. It can be very expensive to connect to two, and I don't think the answer is yes and no for everybody. So I'm not going to say yes or no. I'm just going to say there are questions that you need to answer about the value of why you would do that. My response, if I didn't have enough information, would be no, you should just pick one. And it doesn't necessarily have to be closer. Look at your patient population, the community you serve, which one has the most participation of providers and patients who are served by that HIE. And that has to be a large part of the answer. So, but it can be very expensive to participate in more than one also. I'd be happy to talk to that person more after if you wanted to contact us. Any other questions, Chris?
That's all for now.
Okay, great. Very good. Okay, so as we are talking about where we go from here, patient identity is the priority. There is no reason to bother with any, I mean, if we're talking about an EMR, we're talking about a small network, we're talking about a statewide HIE, we have got to make sure that we have protocols around patient identity. We need to make sure that patients are matched properly. When they come in from multiple entities, somebody needs to be minding that, and you want to know the rules and laws of the HIE around patient matching. So that should be that would probably be my #1 question before I ask anything else, is how do you make sure patients are matched properly? And so what things do you need to know? Are they using an EMPI? Is it a best of breed? Is it part of their HIE? And what's the duplicate rate? And that is, you know, how many patients do they feel have two records in that HIE, two or more, versus the single entities who have been matched properly? And they can pretty much tell that with their analytics and reporting. So how do they onboard new sources? So say you have just pulled in, you're on the border of US and Canada, you've just pulled in a large group that has, now there is a large population of patients who of French descent, and they have your whole geography of or topography of your patient census has just changed. That means your algorithms need to change. The percentage of patients with the same last name or first name, because you have so many people of French descent, has just changed. All the percentages changed, and your algorithm should consider that. So these are some of the neat, interesting, geeky things to consider when you're talking about EMPIs, but you want to make sure that the HIE is considering that. You want them onboarding lots of new sources because that's good for you, but you want to make sure that care is taken to remediate the patient population, make sure that data that's coming in is clean from this new source, and really have goals in place around best practices and when they register patients, when they merge and unmerge patients, things like that. So making sure that somebody has got some good protocols in place for that. And then there are a lot of information sharing options when you're working in your HIE. You have your CCD exchange, and you also have secure messaging. So you've got direct, and so those are exciting options that are available to you that can help you just easily exchange information with other entities, but also pull in anything new. Your patient has been to 3 other places in the last month. They come to you, you can pull that in and quickly get that history and make it available. So the CCD is workflow driven. It's sent at the close of encounter perhaps. That's a trigger-based. Maybe when the patient is discharged. Maybe it's triggered on a nightly batch. Everybody who had a service in that day has that triggered and the HIE is updated. So, or it could be manually solicited CCDs. You might have that as a longitudinal record, which would go back to the beginning of time, and it would just replace each time that you receive from that source. You want to make sure it can be parsed, and get the discrete data out of that. Maybe pull those labs in, problems, allergies, meds, immunizations, and web calls and plugins that allow you to share that information in a way between disparate systems so that each system can understand and use that data. And also with direct, that secure messaging, HISP services. Now you want to make sure that you do have a HISP alignment somewhere along the way. So you might have it with your EMR, your HIE might also serve as a HISP, or can certainly be the conduit, the message transfer operator for those messages. And you want to be able to do CCD delivery, alerts and notifications, and then from a meaningful use perspective, view, download, and transmit for your patients, transfer, transition of care from provider to provider. Those are things that you can get out of the direct portion of that, knowing that that transfer of care was sent via direct, transition of care when the patient was discharged or a referral was made. So now just wondering if you could all take a moment to answer this poll question as well. Just wondering if you are using your HIE currently for meaningful use at a station. And I know some of you said you're not currently participating last time. If you wouldn't mind hitting that again, just so we kind of get a good percentage of the cross-section of folks in the presentation today. So please go ahead and answer that. Okay, so far a good number using it for their meaningful use at a station. We'll just go a few more seconds if there's any last minute voters here. We're preparing you for November. Okay, looks like we're about done. Okay, so 44% said yes, 13% said no, and another 44% said they do not know. So looks like in most cases people are using or plan to use the HIE for meaningful use at a station. Okay. So now other methods of sharing information are those web service calls and responses. And again, that's just a way to normalize the messaging, so that when I send you a message in French and you speak English, there's a translator there who can tell me what the request actually is and turn that around into a response. So we've got the HIE should have all of these, so not just CCD exchange and direct, but also the web calls and APIs and all of those different methods to securely allow for information sharing. And there isn't one thing that's perfect for everybody. In some cases, you want to be able to send flat files to the HIE or interface or in HL7, or you want to be able to just send CCDs. So we want to be able to also get analytics out of this, because that's how you're going to get value. Any HIE should be able to provide you with that option. So analytics, population health, collecting all of that patient data into one single repository and rapidly churning out, where do we stand? How did we do just as on our own, and how do we compare to everybody else? You also can use the HIE for results routing. So considering this as a core service of your HIE and really thinking about the sustainability plan of your HIE, making sure that they have a long-term plan for being able to provide this service. So it will cut down on interface expenses by decreasing all those point-to-point interfaces. You're trying to send those results to, each place singly, and also decreases the need for VPNs, for certificate renewal, things like that are all little gotchas along the way that can interrupt that integration. And then staffing, it should also help from that perspective as well, not needing as many people to manage that and decreasing the duplicate testing by making those results available to everybody who participates. So from the perspective of alerts and notifications, they should be able to be event-based, certainly. So you can notify your providers if a patient was admitted to an ER at your facility or another facility. If they are the primary care provider and the patient has shown up at an urgent care or an emergency department, do they want to be notified? Is the patient discharged? Okay, I should expect to see that patient within 2 weeks. They've been discharged from an inpatient visit at another entity that perhaps I didn't know about the visit. And you should be able to do that as a subscription-based model where you can decide which patients, just your patients for whom you are the attending, the primary care, or how are you associated. And even out-of-range testing. So some, critically abnormal results. Do you want to be notified? Any Department of Health outbreaks. If there is some sort of infectious disease that is kind of percentage-wise reached a level that we need to notify everybody, making sure that that you can be alerted to that as a member of the HIE. So from a public health perspective, the HIE, you should be able to expect some assistance around state reporting for syndromic surveillance, electronic lab reporting, and even with registries for cancer and immunizations. And the HIE is really going to serve as your hub for all of that so that you can send your information, and they should be able to have a standard way of sending that so everybody doesn't have to do that singly and reinvent the wheel themselves. From a patient perspective, where we're talking patient engagement, not every HIE has a patient portal associated with it, but it should be able to align or associate with a patient portal. Even if it's a best-of-breed patient portal that is standalone, it should be able to connect to the HIE, thus allowing your patients to connect however they do, from their computer, their mobile device, and allowing them even through their personal health devices. So you might have a blood pressure machine, a glucometer, Fitbit, whatever it is. If you're using Apple Health, can they allow patients to receive data and provide data to the portal in the HIE? Image exchange with the patient portal is another area that not all are providing, but some will have that, and that's something that you may want to ask about. That may be important to you. So you really want that patient portal to be the main priority place for a patient to go for their access. So that should be their one-stop shopping, which is really our goal. All of us have that goal, I believe, for patients to have one place where they can find all of their data. And then from the perspective of image exchange, if we can do that at the HIE level, certainly the advantages around the cost that you can save by sharing that load across the HIE rather than each of us trying to manage our own. You then have the community access for all of those, and you've got PACs and the HIE work list, and the image-enabled results delivery, and emergency access. So you've got all of these things available that will make it easier for patients to be a part of the HIE. I do want to stop again and just see if anybody has any additional questions at this point.
We do have one. We have multiple sites with different duplicate rates. Do you recommend waiting until all sites have lowered their duplicate rate before sending data to the HIE, or go ahead and start sending and then have the other sites catch up later?
That's a good question, and it's an important question. You know, I just said that is the #1 thing that I would ask, and certainly you want to know where you're at, remediate as many as you can, but there needs to be a balance where you're not holding up progress, remediating those records. And in many cases, what we're finding is the human factor is so important. So if you have established some standards in how you expect things entered into the system, for people to be members of the HIE, you want to make sure that the HIE is not going to just let anybody do it and say, oh, forget it, it's just going to take too long. But there does have to be a balance. So you want to make sure you know the goals of the HIE. Maybe you said anybody with a duplicate rate over 6%, they need to get it down to at least that before they can participate. There are going to be duplicates. There are always going to be duplicates. So you may want to make sure there are goals, that it's well thought out, and that there are instructions moving forward. Every time somebody enters someone's address, street is always ST. It's not the word street. It's not ST period. Sounds silly, but those are the types of things that can really mess up patient identity beyond the names and the more obvious things. So making sure that they have, they're always getting a license, or maybe you have biometrics available, or whatever it is, making sure that those things are in place is important. And then I think that's a personal decision for the HIE as a whole and their members to decide at what point are we going to say, okay, you're ready, come on in. So that's what I would say about that. And again, I'm happy to talk about it in more detail. It's hard to answer it globally when there could be more specifics around the question. Any other questions, Chris?
That's all.
Okay, great. Thank you. And please go ahead and put any questions in that questions pane, and I will have one more round of questions at the end. So coming back to our goal, coming full circle here, so to speak, this is our goal. This is the Holy Grail, as I put it earlier. Not every HIE is there. And that's just the way it is. We're working toward it, right? So as you consider your goals, as we said earlier, before you align with an HIE, understand what are your personal goals for your facility, for your network. How do you see yourself serving your community? How will this help you? So what needs to be in place? So are all HIEs created equal? No. But it's also about you as a member being part of the discussion. So like I've said a couple of times so far, most HIEs are technically able to provide all of the advantages that we just went through. But it takes time, it takes planning, it takes prioritization, and you need to chip away. So you want to be a part of it. You need to take some ownership as well and make sure that governance is in place to manage all of the risks. And there are a lot of risks when you have a lot of people sending information. So from a sustainability perspective, it's also naive to think that you as the entity, as a member, can participate in the HIE without any cost, be it just the interfaces that you manage, or getting the CCDs there, or the overhead around making sure those transfer, to truly paying to participate. The first year, in many cases, what we found is the honeymoon phase. Many of the HIEs or states received grant funding, federal and grant funding, and then they had this big burst, and they just, started onboarding and doing all sorts of great stuff and getting people excited about it, but that money runs out. So there needs to be a way to monetize an HIE long term to make it sustainable. And there are some where the payers, the insurance companies, are footing the bill. There's some where the state is still participating, some where they have providers pay. So we had a neat one where there was an RFP out that I was looking through in order to respond, where they cited that as the exact example of the funding had run out. They did have a tiered model for participating in the HIE, but it was trying to do it by the number of physicians in a group or how many patients a hospital served and things like that. So everybody's trying to find their groove for this, what works, what's sustainable going forward for our communities and the people we serve. So there isn't one way to do this. So you definitely want to do your homework there as well and understand that you may have some of the burden of paying for that and keeping it going. So you also want to make sure that you're making sure it adds value for you. So make sure that the information is accessible, not just mine, because then HIEs won't last. People will pull away, like that first example I had earlier. So you do want to make sure that the information is available, accessible, useful, valuable. Use it for meaningful use. Use it for patient care. Use it for communicating with patients. So that is an important component of this. So some of the common pitfalls are around governance. Making sure that privacy is in place. People need a warm and fuzzy before they're going to become members and put themselves out there that this is well guarded. We had one site I was working with the, the Break the Glass. There were so many Break the Glass events that they couldn't look at them all. And so who was watching it and who's going to say, oh, that person broke the glass, they must have a need to know. So really putting some governance around that. How do we follow up? Who's going to follow up? That type of thing. And even getting into multi-states and the age of consent. Those are things that that need to be thought out. Those are some of the burdens around HIEs, especially when they have patients from multiple states who are in their HIEs. So those are some of the big challenges, not impossible, but you do want to make sure somebody is looking at that. And the cost, of course, I just went through that a little bit, but again, I can't say enough. You need to participate, and that's how there will be return on investment. Being the first is hard. It is the riskiest, but get all your friends together and jump right in. So certainly expertise and resources. A lot of people are trying to manage interfaces and they don't have an engine, they don't have the architecture in place to manage that. They have interface engineers who are, really out straight as it is with just their requirements outside of the HIE. And so building up that expertise and so hopefully getting some of that in place. And patient and provider onboarding, again, showing them the value, what's in it for me. So feeling like, a lot of times I'll hear, oh, the provider says that he or she can just get it themselves, and show them how easy it is, really making sure that you can make the case for why is this important, why did we do this, what value does it add, how can it save time, money, make patients safer. So those are the types of things we want to make sure that we are really champions for this HIE so that people will understand that it is worth their time, it is worth their while. And the providers want to know why. They want to know, patients want to understand why do I care and what's in it. And that means investing in some of the marketing, promoting the program, investing in education for patients, for providers, and making sure it's mobile. We hear that all the time, but is this mobile? Can somebody look this up on their phone, find the information they need easily, where they need it, when they need it? And then being an active member. I know I've said it a few times, but it is just too important that to make these last, to find the value, you need to participate and expect those analytics. Demand them if you need to. It's all in there. You've got so much great information in there. It needs to be shared. It needs to be utilized to improve healthcare. So follow up with the providers. Make sure you know who's using it, who isn't. Find out why. Why aren't they using it? Are they struggling? Are they not techno-savvy? Do they need an easier way? And then try and help make it happen. So people need to hear success stories. So if you have providers who are great users, tell us something great that happened because the HIE was available to you. How did it help you take better care of a patient or receive a meaningful use payment more quickly or anything like that, and re-educate as needed so that you can get people excited about it. So that's really how we can move this forward and keep the value of this great information exchange. That's what it's all about. Exchange means we all have to participate, right? So hopefully you have picked up some good ideas here and know a little bit more about HIEs than before you started a little less than an hour ago. And if I can help in any way, or I have great resources around me as well, I'd be happy to receive your questions, answer those, get on a call with you if we can help at all, and hopefully help you to get more value out of your HIE or help you decide what's the best way for you to participate in one. So please feel free to reach out to me. I do want to open the lines again one more time for questions and just give you the opportunity if anybody has any.
I don't see any at this time, Michelle.
Okay, well, great. I'm going to turn it over to you then, Chris, and you can let people know how we can follow up here, okay?
Great, thanks, Michelle. We do want to thank everyone for attending our webinar today. As I mentioned in the opening, you'll have the opportunity to fill out a short survey, and that survey will open when you exit the webinar. We really appreciate your time. We really appreciate you taking the time to take the survey, and for your time, your name will be entered into a drawing to win a $100 Amazon.com gift card. All those drawings are held at the end of the month. Follow us on social media and our blogs for healthcare IT updates to interact with your peers. And if you'd like more information, you can contact your iAtric Systems account executive, or you can send an email to info@iatric.com, and Michelle also shared her information with you as well. I'd like to thank Michelle. I'd also like to thank everyone once again who took the time to join us. We hope you have a great day, and this concludes our webinar.
Thank you. Bye-bye.